This is going to be a demonstration of a COC1 assessment and a supine COC1 adjustment using a thenar and a zygoma contact. And this is an assessment and a manipulative procedure that blend into each other. The adjustment comes right from the assessment. Right, so when you find the restriction using the assessment, you can just segue right into the adjustment. I'll explain a little bit more about that as I'm doing it. So let's talk about the assessment first. I like to think of this as a choreograph type of assessment adjustment. We're always going to set it up the same way. So both our hands are going to be completely opened up, and to assess it, we're going to take our auxiliary hand, we're going to place it on the side of the head, about a finger's width behind the eye, so that the thumb line is perpendicular to a line through the eyes, just like that. So that's where you place your auxiliary hand. And then I'm going to let my fingers just wrap around, right? And then I'll turn the head so in this case, the left side is up. Part of my index finger and my ring finger on his occiput, and my pinky as well, right? So there's the zygoma, right near the face mask strap. And this hand also gets choreographed in place in that I'm going to open the hand up wide, place the softest part of my thenar on the zygoma so that my thumb points towards the chin and my fingers are behind the SCM. So just like that. All right? So there's where the other hand goes, just like that. And then the assessment part of it is just to kind of hold the head like this and just add a little overpressure through your upside thenar into the hand that's holding it on the bottom. So there's your assessment, just like that. So you're not really doing much other than catching the force with the downside hand, and that's what it looks like right there. Of course, we're going to compare this to the other side, so I'll just reorient my hands. I'll make that the downside. And again, the choreography here is to kind of just point the thumb towards the chin and place that thenar on the zygoma with the fingers all wrapped around. All right? And again, just that moves a little bit. Did you feel that? And that overpressure is applied. Now I'm off to the side because I didn't want my back to go to the camera, but if I was doing this, of course, I would kind of just go in place like that. All right? So let's demonstrate the adjustment. All right? So again, auxiliary hand. All right? Notice the headpiece is elevated. I'm going to slide you up just a little bit. That's what gives you your lateral flexion. So you're not lifting into lateral flexion during this adjustment. The headpiece already gives you the lateral flexion. So to deliver this adjustment, what you're going to do is get into that assessment position. And I'm going to exaggerate this a little bit for demonstration purposes. The doctor's relaxed. Very, very relaxed. And again, your thrust is towards your thumb. So you can see the preload's already there. Before I even lay my other hand down on the patient, the preload is there. And this adjustment comes from just adding that overpressure in with the contact. Is it okay to go ahead and do that? Mm-hmm. All right, so you're relaxed and just kind of thrust into it. All right? All right, thank you very much. I appreciate that.